meeting we try to keep pretty short and primarily share updates from the different implementation groups of this sector that are moving forward. So that's what we'll start with today. Oh, hey, Jody, I was just giving an overview of the agenda while you're signing on. So we'll talk a little bit about our Just Walk program. We'll talk about the curriculum group that's been meeting to bring Dr. Jennifer Trilk to Kansas City to talk about adding or including lifestyle medicine curriculum into curriculum of medical schools, PA students, nursing, dietitians, OTs, PTs, whatever health professionals we can get some movement with. And we'll give a short update. Dr. Dave White, who leads the billing and reimbursement implementation group, is not able to join us, but we'll give a brief update about his project related to billing and reimbursement for physical activity assessment and monitoring. So I see Jody's joined us. I'll turn it over to you, Jody.
All right, sounds good. Thank you. So I think I've met most guys before, but I'm Jody Dickmeyer. I work at Children's Mercy in the outpatient pediatric care clinic. I am helping lead the Just Walk sector or Just Walk subgroup of our healthcare sector. We just had our meeting this morning, so we have some good updates for you. We had taken a little bit of a hiatus during the winter months just because we were having some difficulty finding an indoor structure near Pearson Park to hold those walks. And then also our interest was kind of down a little bit at the end of November, December. But we are going to restart on April Fool's Day. So April 1st from 9 to 10 Pearson Park will be our next walk. If anyone wants to join just for walking purposes, are more than welcome to do so. We do have enough volunteers at this point. And then Caitlin Bennett from Children's Mercy is going to be presenting Project Adam during that walk. So we can put some of that information in the chat. We also have a new flyer that Katie helped create. And so Katie, if you want to put that flyer in the chat too, if any of you guys are interested or want to distribute that information to anyone else, you're more than welcome to. As far as that walk, we'll continue to meet the first Saturday of every month from 9 to 10 for at least the next few months. We've been trying to do some outreach to the area into the school district to see if we can get some extra participants. And then we're currently working on staffing with a bilingual, either physician or healthcare worker, so that we could potentially give those topics in Spanish as well. As far as the second update for the Just Walk is that we are going to expand to Harris Park, which is in the Ivanhoe district. Again, we can put some more information about that in the chat, just about Harris Park. It is an urban setting golf course created by Chris Harris. And so he was interested in trying to extend to some other programs that could help promote physical activity and wellness to the community as well. So they have some children's programming coming up at the end of May into June. And they were suggesting maybe if we did the Just Walk, we could get some of the parents involved in the walking instead of sitting in their cars waiting for their kids to get done with their activities. They could actually do some physical activity themselves as well. So that next walk will start May 31st. It's a Wednesday. It'll go for the next 6 Wednesdays until July 5th. So it's just kind of a 6-week trial period to see how it goes. We do not have all the information yet set up for that one, but likely we'll start around 5:15, going for an hour. And again, we'll need about 3 or 4 volunteers for that. Does anyone have any questions? Thanks, Katie, for putting all that information in the chat. So we have some exciting things coming up. So hopefully we can get people out there and walking. All right, well, I think we can go on to Jay. And if you guys have any questions that you think of, just go ahead and put those in the chat. Did I miss anything, Shelly? Nope.
Okay. I don't know. You guys see me? Sorry, I was eating. I didn't think anybody wanted to see that. Yeah, that's awesome on the Just Walk, especially the Harris Park thing. That's really cool. Sorry, I missed that meeting this morning. I had a dentist appointment. But yeah, the curriculum meeting. Shelley and I have been emailing with Dr. Trillick, and it sounds like she's got some time in September, and that seems to work for kind of all three of the medical schools as sort of our our ideal audience for her talk. I think the logistics are just the biggest thing at this point. It sounds like it might work out best to have like Children's Mercy as the grand round site and invite everybody else virtually recorded, all that kind of stuff. And then for her to kind of break out into small groups over the course of a couple days at each of the different med schools. Again, that's kind of her expertise, is the med school area, although we all have the idea of including all allied professions, healthcare professions in it. That's just not really the focus of her program, but I'm sure she's got some insight into how to make that work. So we'd be inviting any and all who would be willing to listen to her and learn from her. So I think cost is another part that we're trying to figure out and kind of hammer down what the cost is going to be, and then who all is going to foot whatever different bill. So I think between the KCPA plan funds, hopefully some Children's Mercy funds, we can maybe take care of the grand rounds part, and then everybody else can kind of chip in for their small group sessions. I don't know if that's the ideal way to do it, but that's kind of how it would work in my brain. But I'm not a curriculum director or a med school director, so I don't know how all those funds are always appropriated and stuff. So that ultimately is the goal, and I think it's moving forward. It's just hammering out the details at this point. Anybody got any questions about that update?
The only other piece I'll add to that is this group, the group Jay is talking about, meets on a monthly basis right now. Our next meeting, I believe, is April 4th at 11 a.m. Many of you, I think, are already included in that meeting invitation, but I'm looking to you, Joan. You may not be on that, but if you're interested in attending, we welcome your participation. Just let us know if you want to be added to that meeting invite, and we'll go ahead and get you on there. Joan, is that a head nod?
And then Dr. Kamath, also, if the stuff with Dr. Trillick doesn't work out, she's got some sort of backup speakers that we could potentially bring in who could also speak really well to lifestyle medicine curriculum as well. So
yeah, just let me know and give me enough notice, because I have not initiated the conversation since it's a backup, but certainly sure. I could reach out to them. Thank you.
All right. Thank you.
We're really excited to be moving that piece forward. It's taken us a little bit of time to get this off the ground, but we really feel like bringing her to Kansas City, or bringing speakers to Kansas City to focus on this effort will really jumpstart this change.
Yeah, it's a good catalyst.
Mm-hmm.
That's really exciting. Great job, guys. I've been seeing you guys work so hard on this for months, so it's exciting to see maybe an endpoint. All right, well, Shelley, do you want to do the updates on the billing sector?
Yes. So Dave White is an exercise physiologist at Children's Mercy in the Heart Center. He has been working on a small project with some patients that he sees looking at remote patient monitoring as a means to provide exercise prescription and bill for those services using some of the remote patient monitoring codes. It is a bit challenging to get this project off the ground. There are some remote patient monitoring systems that exist, some places across the country and even locally that use some of these, but the equipment is generally supplied to the patient, and that's a key component of successfully moving this forward and sustaining it. The cost of that is pretty expensive, more than Dave has as part of this initial project. So we're really exploring what are the patient codes that we might be able to use, who can provide the assessment of physical activity and counseling, how do you monitor the physical activity, and we're exploring adding a component of that to a patient care app the hospital uses. So this is probably going to be a slow process, but they are meeting on a regular basis, sort of outside this other work, because there are other areas within the hospital that are also interested in physical activity as part of their disease management and treatment. So we're, again, really trying to connect people both locally. KU Med is doing something. Dr. Kramer and I were just talking about a physician who I think sees patients at University Health in Lakewood, but is also affiliated with UMKC. He's using remote patient monitoring. So we're going to try to get all these groups together to learn from each other and figure out how do we better understand the billing model, what tools are available, what insurance companies, how insurance companies might view this. Right now, as far as I know, the projects that are moving forward are all grant funded. This needs to be, in order to be sustainable, this needs to be reimbursable by insurance companies, or we're going to have very little success with uptake. So we hope to provide ongoing updates. If anybody has experience in this area or is really interested in joining some of these additional meetings that we're setting up to learn more, please let me know. And I see Dr. Roberson with his hand up.
Yeah, sorry, which physician did you say at Lakewood? Did you say the name? I missed that.
Dave Varan, is that right, Dr. Kramer?
That's correct. Yeah, he's a family doctor. He's semi-retired, but does still come in at least a day or two. I'm not sure if he's seeing patients on his own, but he's probably still supervising family medicine residents in the clinic, and very, very tech savvy, and kind of on the cutting edge of a lot of the patient wearable kind of devices and other remote monitoring.
Yeah, I was thinking, Meg Gibson being in charge of the sports medicine department out there, and with her fellows and everything, I wonder if there would be any room for collaboration with them, if they would be willing to join in with that. I could always reach out to her and see if that's something they would be interested in, because she's got a couple of colleagues who are very also tech savvy and like using devices and stuff out there. I don't know if that'd be a good overlap or not.
Well, I think that's a good point. I would definitely reach out to her and mention that I'm in this group, and that I've connected David Varan in. She knows both of us, so that'd be a good connection.
Cool. I will. I'll chat with her soon. So
Great.
Thanks, Jay. Any other questions or comments about that work? Okay.
And I'll just mention to the group, Shelley, if you don't mind, I'm going to have to jump off. Rarely, you guys probably have this all the time. Rarely do I have 3 Zooms meetings scheduled at once, and one of them is absolutely required, and that's the one that just started a couple of minutes ago. So I'm gonna have to jump on that very soon. So if there's any questions for me or anything, I'm here right now, and then I'll be gone.
We appreciate that. And if anyone has any questions for you, I'll be sure and follow up with you again after the meeting, but thanks for all the support you've.
I have no doubt that you will, Shelley. So that's great. That's great. All right. Thank you.
Thanks for joining us.
Thank you.
You bet.
Well, Shelley, I know you already talked about it a little bit, but as you mentioned, we do still have some funding available for the healthcare sector. We did ask for some of it for the Just Walk and to start up the second Just Walk location. And then at our meeting this morning, we also discussed maybe having some of those funds available for maybe some t-shirts or some water bottles for promotion of the Just Walk events. And then obviously Dr. Trillick trying to get her here may be part of that funding. But if anyone else has ideas or wants to submit a proposal, please reach out to us as well, because we do have some remaining funds available. And then Shelley, do you want to update us on your Girls on the Run?
Yes, I'd love to. So I wanted to share some community opportunities that we have going on in and around Children's Mercy. First, I'm going to mention the community garden. So for those of you who don't know, Children's Mercy has a community garden. It was established in 2018 at a vacant lot the hospital owns at the northeast corner of 22nd and Gillum, where Gillum sort of turns into Oak. In that garden, it's a volunteer run garden. It's the produce is distributed to students at the UMKC Student Food Pantry, to the Kansas City, Missouri Health Department through their pop-up food pantries that are just getting started again, to patients and families that might be in the area or coming to clinic at the Don Chisholm building, to people who live in the community. And then we also try to use it as an opportunity for education. As part of that, Girls on the Run has a community team that meets at the garden. So they get sort of a double whammy of physical activity. So they're training for a 5K, and they also get a chance to be a little bit active in the garden at the hospital and learn about gardening at the same time. They meet in our space on Tuesdays and Thursdays. They'll meet from this, they're off this week because of spring break. So they'll start next week and they'll go through the first week of May. For those of you who see patients in and around the Children's Mercy Adele Hall campus, I thought it would be helpful for you all to know this is a community group for Girls on the Run. That means anyone can join it. We typically have spring and fall teams. So if it's a little bit too late to join the team now, although they would never turn anyone away, we'll have a team back in the fall. There are flyers that exist. We're happy to help you get the word out about that, but we just wanted you to know that that does take place. They run and practice in Hospital Hill Park, and that's right after the training and education in the garden. And we're always looking for coaches. And so there's a question about med students joining the Girls on the Run. I would say absolutely yes. And if they are interested in being involved on a regular basis, that would be sort of considered a coach. They are always looking for additional coaches and leaders/mentors for the girls that participate. So the coaches would be girls, women. So I would encourage any of them to either reach out to me if you're interested, and I can connect you with Girls on the Run specifically related to this team. But wanted you all to know that that was happening, both the garden and the Girls on the Run team. As a volunteer run garden, we're always looking for volunteers. If anyone is interested in either connecting students to this volunteer opportunity in the garden or volunteering yourself in the garden, please let us know. You can email us at communitygarden@cmh.edu. We'll add you to our volunteer list. You do not need to know anything about gardening to be a garden volunteer. You simply have to have the interest. We'll give you all the instructions, connect you with great videos, and tell you everything that's going to happen in the garden for the time that you're volunteering. An additional piece of information I want you all to know about is Camp Win. Are you all familiar with Camp Win? You can either raise your hand or give me a thumbs up. I know I know Jay is, Jody is, okay. Well, for those of you who are not, Camp Win is a camp for girls run by Win for KC, which is the Women's Intrasport Network, a program of the Kansas City Sports Commission and Foundation. Win for KC is focused on women and girls in sport and using that as a means to develop additional skills, whether it's leadership, confidence, etc. They have a camp that they host every summer. They are now up to 3 weeks for camp. There are 3 different locations for their camp this year: Notre Dame de Sion, St. Teresa's Academy, and Lincoln Prep. They are 3 weeks in June. The camp has a sport sampling concept as its I don't know, method of engagement, I suppose. So girls will be introduced to at least 14 different sports in a safe, non-competitive environment that allows them to try them out when they might not otherwise get a chance to try those sports. They are looking for campers. Oh, actually, they're not necessarily looking for campers. The paid camp positions are full everywhere except for Lincoln Prep. They have scholarships available for all locations. We do have a flyer. Oh, it looks like Katie has dropped the flyer for Camp Win into the chat. For anyone who's interested, we also have links to the registration information on the Win for KC website. If you have someone who you know might qualify for a scholarship and be interested, we can connect you directly with Win for KC and their scholarship person to help with that. But again, we think it's a great opportunity for girls to try different sports in a non-competitive environment with a bunch of other people who this might be new to as well. Any questions about that? Okay.
So Shelley, again, you said we can give that flyer out to people, but how do they find out about the scholarships?
You can give the flyer out to anyone. The scholarships, we have a link to information about scholarships, I believe, or I would say just direct them to us and we'll connect them with the right person at Win for KC. Oh, it looks like Katie was able to drop a link in the chat. But anyway, if you lose that link or forget where it is or whatever, we're happy to help make that connection. They should be able to go on the website, and there's on the website, if they navigate it well, there should be a place for them to choose information about scholarships. But if they don't have access to the intranet for whatever reason, we're happy to make those connections.
Okay. Wonderful.
Any other questions about that? Okay, then the last thing I wanted to bring up, and this is something we're working on with all of the sectors of the Kansas City Physical Activity Plan. Many of you have heard me talk about our website, and we are working very hard to drive people to our website for information and resources. So it's in one easy to find location on our website. And maybe, let's see if I can pull this up. It's so hard for me to talk and navigate things at the same time, but I'm going to give this a shot. Katie, I'm going to try to share my screen. I don't know if I have permission to do it, but. Can you all see my screen?
Yes.
Okay. This is our physical activity plan website. I'm going to go to our home page. This is what the home page looks like. On the website, you can find information about the national plan, the US report card, the Kansas City physical activity report card that we developed, summits that we've hosted, strategies and tactics, each of the sectors that are moving forward with the work, and meeting information. I want to point out a couple of things to you. One is newsletters. This is the healthcare sector meeting. At the end of each meeting, we send information out in a newsletter format. If you ever lose that newsletter, gets down in your inbox, or you need to delete it for whatever reason, you can always go back to our website and access the most recent newsletter here. You can find meeting information to register for the meeting. You can find links to the notes, recordings, and additional information. The other thing that we have been working on, let's see here, is adding additional information and resources to our website. So on the healthcare sector page, we have our strategies and tactics listed here. We will be adding additional information that's useful to this sector, but we've recently been asked both by organizations within the sector, but also by outside partners to help compile resources for them to use to promote physical activity. I'm going to stop sharing for now, and I'm going to ask Katie if she might be able to bring up the back end of the website. We have created a page on our website where we will begin compiling resources. So there's two things I want to share. One, what that's going to look like, and then two, ask this group if they will be willing to help us through this process. Okay, so Katie, can you walk us through this on your screen?
Yeah, I hope so. So this is just the mock-up. It hasn't been published yet, but it'll go under learning. Did you already mention that, Shelley, that it'll go under learn more? Oh no,
It will,
are we under the sectors?
I think it's going to be under learn more, and it will
Okay,
be
yeah.
a separate item called resources. So just as I showed you newsletters a second ago, this would be labeled
Under there.
resources.
Yeah, and so essentially every sector will have their own resources, but we'll have them compiled onto one page, but it's an accordion. So when you click on this, you'll see it expand, and then you'll be able to click on these resources and access them from here. So for healthcare, again, it's just a mock-up. We've got one right here, but it'll directly link you. And I don't have my screen set to be able to show you the website it links to, but it'll direct you directly to that website. But right now it just looks like this.
Any questions about that? Thoughts, recommendations?
So is it more just like resource links, or is it more like activities that are happening?
This will be more resources. So the activities that are happening, if it's an event, that will be information we'll probably share through our newsletter, especially since most of them are time bound. In terms of resources, this would be things like maybe toolkits, so you can see the other websites. So an example would be NCORE, which is, oh my gosh, now I can't think, and I can't think of what it stands for off the top of my head, but they have a number of tools that can be used for evaluation purposes. So for example, they have compiled resources related to evaluation. So if you're trying to measure physical activity, they have, I don't know that I'm making this up from a numbers perspective, but let's just say the top 10 ways to evaluate physical activity, whether you're going to do it in a screener or you're going to do it from an observational standpoint, that sort of thing. Something we can include on under the healthcare sector would be the physical activity guidelines established by, and I think the CDC, maybe, I forget who actually supports the process for review of physical activity recommendations. But that would be one thing that could be included there. We'd include a link to the NCORE website. We might include, you know, on this example, we have a link to the food, nutrition, and physical activity screener. This is something that's been developed by Geisinger in conjunction with, I believe, the Academy of Nutrition and Dietetics. It's a 20-question screener. It's what our presenter for the healthcare sector special event talked about. It's used in primary care settings. There are questions related to nutrition and physical activity that they then use to try to encourage patients to be more active or make better choices from a nutrition standpoint. So
one thing that I think would be nice to have on there would be its tab. And so it would just be easier to get to, because I feel like it's hard looking through different newsletters. So it'd be nice if there's like an up-to-date tab that shows upcoming things in the next 3 months or something, or even a calendar. If there's a calendar link on there and you could put stuff on the calendar, I think that would be easily accessible by people. That's my 2 cents.
So the calendar idea will be something we'll take back to our team and figure out how we might be able to do that. The other thing, the other idea that we're contemplating as part of the Kansas City Healthy Lifestyles Collaborative Team, and that's those of us who are supporting moving the physical activity plan forward, is a tool, platform, I don't know what to call it, that can be used for two-way communication. An example of how this would be used would be two things. So one would be, I have a need for something. Does anybody have any experience with X? So sort of like listservs are used in many areas. Another way it might be used is for what I've just been sharing, those updates about Camp When, Girls on the Run. It would be a way to say, hey, here's this idea that's available for anyone who might be interested. So we are looking into platforms that we might be able to use to make that easier. So people don't have to go through us to communicate with a broad group of people who are interested in the physical activity plan or the different sectors. Is that something you all think would be useful as well? And if so, have you had any experience with anything that you thought was really awesome?
I mean, I think having like a Teams channel has been helpful in Children's Mercy. Obviously, it's easy to do those kind of things, but yes, to make it a little bit broader, I don't have a lot of experience with that, but I do love our Teams channel. It's really easy and nice to access resources.
Well, we'll keep working on those and we'll share updates at future meetings.
Hey, Shelly.
Yeah.
Sorry. Would you all, we might have a few resources if you'd be interested. I can send them your way. I'll compile a list. Our Maternal and Child Health Bureau, they don't necessarily come from us, but we partner with a bunch of different organizations, and they might be helpful resources to include on the website if you're interested.
Sure.
Yeah.
Thanks, Maisha.
Yeah, no problem.
Okay, I think that's it, unless anyone else has any updates they'd like to share.
I have one more thing.
Sure.
Sorry. We have some, this is not necessarily physical activity plan related, but healthcare related in general, health workforce. We have some scholarship and loan repayment programs that we are giving out to students. Well, they have to apply for them, but they're coming out of our Bureau of Health Workforce. The applications are live now, and I'm trying to find the sheet so I can put it in the chat. The applications are live now. They'll close. One of them will close April 25th and the other one will close April 27th. But the loan repayment programs are for dentists, physician assistants, NPs. We have some for social workers and psychiatric nurses and all of that stuff. So I'll post those in the chat just for you all to disseminate out to the people you know, because they're helpful resources. I don't want people to have to pay for school if they don't have to. That's silly. So I'll post them in the chat for you all to share.
Thank you.
Thank you.
Thank you. That's wonderful.
Yeah, Shelley, I have a question for you and everybody else is out the room. They don't have to listen to it.
Yeah.
But
Well, then the last thing I'll say is our next meeting will be Tuesday, May 16th at 12:15. As a reminder, we share this information in our newsletter and we send out Eventbrite meeting invitations. So don't forget to register for the meeting using that or the link that Katie just dropped in the chat.
I'll remember to register. Thank you.
Great to see you all. Have a
Bye.
great week.
Thank you.
Jay, I'll stay on for just a second.
yeah,